The topic for today's discussion is about the biotransformation. Guys, this topic is going to be very easy for us from now onwards. Why? Because we're going to cover the very interesting and needy important points of the topic. Like, we'll talk about the definition, what is the meaning of the word biotransformation, then definition, and then we'll talk about interesting enzymes, their role, then we'll talk about the phase 1, phase 2, and some tricky and important points here in the phases of the reactions. We'll talk about those points, and further we'll tell about the sites of the drug metabolism on tissue level and on cell level, and then we'll talk about the why question. We'll give you the answer of the question. The question is why drug metabolism is necessary, why biotransformation is necessary, what is the need of the biotransformation. Well, all these kind of questions will be actually answered via this particular point. So we're going to cover interesting points, okay? So what I need from you guys right now is just your concentration. When you just give your concentration here, you're going to get this entire lecture in a very, very easy way. Yes, I guarantee you are going to get it in a very easy way. Now just concentrate. Guys, biotransformation. Now just first of all, let's split the word biotransformation into two. The very first, bio. We know about this point too very well. Bio means life. Transformation means to change. Now, just combine these two words together, these two meanings. To change, living. What does it mean? You are studying pharmacology, so it means about the drugs. What if the drug gets changed in the living organism? This changing mechanism of the drug in the living organism is called as biotransformation. A very simple definition which we just made from the word splitting, from the term splitting. We just split the word or the term biotransformation into two. Number one, bio. Number two, transformation. Bio means life. Transformation means to change. To change in life, to change in living organism. What? Drug. When the drug changes in the living organism, this is called biotransformation. Remember, another name for the biotransformation is drug metabolism. In shortcut, we can call it as drug metabolism. What is biotransformation? Simply, it is drug metabolism. It is the simple definition. What is biotransformation? A simple literal definition is it is drug metabolism. Good. Well, now let's come towards a little bit modified scientific, a little bit more scientific definition. Now what is that? Simple. Chemical alteration of the drug by enzymatic activity in the body. Now all these two points are actually a kind modified by these words like chemical alteration and enzymatic activity. Just these 2 points are added and the rest of the story is the same. Now what is this actually talking about? Simple. It is the chemical alteration. What? Biotransformation or drug metabolism is the chemical alteration of the drug by the enzymatic activity in the body. In the body we have enzymes. So those enzymes will alter, they change chemically the drug. This kind of changing mechanism of the drug by the enzymes in our body is called biotransformation. Very easy. This is not that much difficult, okay? I hope so you got this point. The definition, I hope it is clear. Now let's come towards this point, enzyme. We know about enzyme. We have been studying this from the very, very first classes of the school level, okay? Well, if you know about this enzyme, write a simple definition of the enzyme in the comment box. It would be very good. I love it. Well, coming to the point, enzymatic activity by the enzymes. So what are the important enzymes responsible for the biotransformation? A question may be asked from you guys. What are the enzymes responsible for the biotransformation? A very simple answer. There are two types of enzymes in a nutshell. Number one, microsomal enzymes. Number two, non-microsomal enzymes. These two enzymes are responsible for the biotransformation or for the drug metabolism. I hope it is super duper clear now. Now, microsomal enzymes. So where are these enzymes in the living body? A question. A very simple answer. In the endoplasmic reticulum, we have microsomal enzymes, and in the mitochondria and cytosol, we have non-microsomal enzymes. Here we got a cell. Here we got a nucleus. With this, we have endoplasmic reticulum, and here we got double membrane mitochondria, so-called mitochondria, and cytosol. So all these three portions, number one, number two, number three, are actually the spots, the sites, the points where these enzymes are available. Which enzymes? Microsomal plus non-microsomal enzymes. So these are the enzymes responsible to do the biotransformation. A question: what are the enzymes responsible for the biotransformation, or what are the names of the enzymes that are supposed to do the metabolism or the drug metabolism or the biotransformation? Simple answer: they are actually the microsomal enzymes and non-microsomal enzymes. Further, they are actually located in the cytosol, endoplasmic, and mitochondria. Endoplasmic is specific for the microsomal enzymes. Mitochondria and cytosols, these two are specific for the non-microsomal enzymes. Well, these two collectively they are called as metabolizing enzymes. What? Metabolizing enzymes. So these two, microsomal and non-microsomal, these two collectively we can call these two enzymes as metabolizing enzymes. You may be asked question in exams, what are the metabolizing enzymes? Because it is pharmacology, so you must be knowing that these are the enzymes called as non-microsomal and microsomal enzymes, which are located in the endoplasmic reticulum, mitochondria, and cytosol. Responsible for what? For the metabolism. Well, the name indicates metabolizing enzymes. Such enzymes responsible for the metabolism. And don't confuse yourself when you are studying or when you are giving the answer with the drug metabolism and biotransformation. Both are the same. Biotransformation actually means drug metabolism. Drug metabolism actually means biotransformation. So you can use any term, and any term can come in the exams for you guys, or can be asked in Viva. Well, now we know about the enzymes. What is their job? They're supposed to facilitate reactions. So here we have reactions like oxidation, reduction, hydrolysis, and conjugation. These are the four types of the reactions that are being facilitated by these enzymes, metabolizing enzymes, which are microsomal and non-microsomal enzymes. These are responsible to facilitate these reactions: oxidation, reduction, hydrolysis, and conjugation. More, if you go in depth, oxidation and reduction reactions, for these we need microsomal plus non-microsomal enzymes. Here I have mentioned we need these two enzymes. Well, if we talk about the hydrolysis, for that we need non-microsomal, just this one, non-microsomal. And for the conjugation types of the reactions, here we don't need these types of the enzymes. Here we have some other function groups which are playing important role in the drug metabolism. Those functional groups are glycine, methyl, acetic acid, glucuronidation reactions. You know about that. So such kind of functional groups are actually added to the drug to make the drug polar. Well, we'll talk about that a little bit later. So first of all, coming to this point, from first till three, these reactions are actually placed in the phase 1 reaction according to pharmacology. These three reactions are placed in phase 1 reactions. So you might be asked about the such kind of questions in exam. What are the types of the phases, or how many phases are there in drug metabolism? Question: you will say 2 phases. Phase number 1, phase number 2. In phase number 1, we will talk about the oxidation, reduction, hydrolysis reactions. So these reactions are actually placed in phase number 1. And phase number 2, in the phase number 2, the drugs are placed in the metabolism is actually the phase number 2 includes conjugation. So in exam, question is asked, how many phases are there in drug metabolism? A simple answer: 2 phases. Phase 1, phase 2. So phase 1 includes oxidation, reduction, hydrolysis. Phase 2 includes conjugation reactions. So these are actually the reactions and the phases. Okay. Now, moreover, you can be asked in exams, so what is the difference between phase 1 and phase 2? Why we call phase 1, phase 2 to these reactions? What is the reason behind? Very simple. Phase. When we do something in one phase, in 2 phases. So the same goes for the metabolism. Metabolism is actually a kind accomplished, a kind completed in 2 phases. Phase 1, phase 2. Drug is first of all supposed to go through the phase 1 reactions: oxidation, reduction, hydrolysis. The drug is first of all supposed to go through all these phases. After that, when the drug is metabolized via these reactions, so the drug is a kind modified. Now, the very important function, the very important role that is being played by these enzymes is to make the drug polar. So by means of oxidation, reduction, hydrolysis, by means of all these 3 reactions, the drug is become actually a kind made polar. The drug is made polar. Then this is polar, but not that much. which is needed actually. So further polarization, further to make a drug more polar, there is another phase responsible for that, which is called as phase 2. In the phase 2 we have conjugation reaction. Here, by means of glucuronidation and etc that I just mentioned, methylation and blah blah blah. So all these conjugating substances, they combine with the drug that has been through phase 1. So they combine with them and they make the drug more polar. Remember guys, drug first of all goes through phase 1, it is modified, then it enters into the phase 2. And there are certain drugs, they actually skip the phase 1 and moves to the phase 2. They move directly to the phase 2. Now what is the reason behind? Very simple. Phase 1 enzymes, microsomal, non-microsomal, they are very specific. They can only interact with a specific substrate. Enzyme, substrate. Specific enzyme is here, specific substrate can interact. Means they are kind of selective. So if a drug comes which is having a kind of a change sort of structure or composition, means consider the drug as substrate. So if that substrate is a kind changed, having a change kind of structure with these phase 1 enzymes, so they will just skip the phase 1. Why? Because phase 1 says, I don't want to interact with any other person. I need the one that I know, the one that is specific for me. So specific substrate is supposed to interact with the phase 1 enzymes. So phase 1 enzymes are specific. So that's why some of the drugs may cross the phase 1 and then we move directly to the phase 2, where in the phase 2 what is happening? Conjugation is happening. So phases, by phase is what we mean that drugs are supposed to undergo first step and second step, once and second time. So 2 times a drug is supposed to go through, and there are certain drugs they don't need 2 times modification, they just need 1 time modification, that is just phase 2. Means in short, phase 2 is must. Okay, and phase 2 enzymes, they are actually a kind non-selective. They can interact with any drug. Means any drug can be metabolized, and at the end the drug is made polar. Why? What polar? So we talked about what is the important function of all these enzymes, these reactions. That is to make the drug polar. Now a question rises. We got the point to this place. A question rises: why? What is the need to do the metabolism of the drug? What is the need? A very simple answer for this question is that we actually make the drug polar. When the drug is made polar, then it is easy for the drug to excrete from the body. Why? The polar drug is not supposed to be absorbed by the membrane. We know cell membrane is actually lipid bilayer, lipid made. So lipophilic substances can be reabsorbed. But if it is made polar, then it has got very low chances to absorb, to be reabsorbed. So that's why the more the drug is polar, the more it is supposed to go through our body, the more it is supposed to be excreted easily. Now a question again rises: why to excrete the drug? What is the need to excrete the drug? We took the drug to do the job in the body. Now it is supposed to do its job. Why it is moving out from the body? Again, if the drug stays in your body for a longer period of time, it will cause complications to you. So that's why it is important for the drug to go through the biotransformation. And again, if the drug is not metabolized, it will not show actions also. So both the things are necessary. Drug metabolism is necessary in each and every case. So regarding these phases, it is necessary to make the drug polar. The more the drug is polar, the more it is having a kind of ease while excreting from the body. Means it is easy for the drug to excrete from the body then. Sites, regarding sites, it's very easy peasy for you guys. Why? Because we have got the entire discussion. You might have got the understandings. Sites, we'll talk about tissue level, then we will go to the cell level. On tissue level, the liver is important site for the drug metabolism or for the biotransformation. GIT, lungs, kidneys, adrenal glands, skin, and remember, our entire body has the ability to do the biotransformation or the drug metabolism. But liver has got a standard level, a high level. So that's what about the site regarding tissue level. Then we move towards the cell on cellular level, where in the cell, what is the site in the cell where drug metabolism actually takes place? Simple, we got here. In the cell we have cytosol, where the drug metabolism is taking place, endoplasmic reticulum, and mitochondria. These are the place or the spots or the sites where drug metabolism is taking place if we talk about cellular level. So this is about regarding the cellular level drug metabolism. Now do one thing, that is, don't forget telling your friends about Dr. UUT lectures, okay? let them know about this lecture, about our lectures.